I'm Jessica. I'm one of our certified veterinary technicians here at River Valley Veterinary Service, and today I would like to introduce you to our new microscope that we have in our lab and show you a little bit about its capabilities and how it helps us in helping your pet. We've upgraded to our new one, which has a screen, and the best part we're liking about this is we actually can have clients come back and then they can see what's going on at a microscopic level with their pet. So here what we're looking at is a picture of an ear, and this dog had an itchy and red ear, and we're able to take a cytology of it, and what we can see here is a yeast bud. The yeast kind of helps show us what we need to use for treatment and what type of infection we're dealing with. We have many different medications in our arsenal, and deciding which one it takes is where the cytology becomes very helpful. We also, here is what we're looking at, is a stool sample from a dog. We do want to see stool samples every year on pets because it helps make sure that they're getting the proper medication and that their intestinal systems are happy and healthy. What we're looking at right here is what's called coccidia, or Isospora is its scientific name, and this is a protozoal type parasite that can cause a lot of diarrhea and discomfort in pets. This is another type of parasite that pets can pick up from eating the gross things that we don't want to touch, and this is a hookworm. And this is another type of cytology. This comes off a skin cytology, and this would be a dog that had a wound or a little sore. And what we're looking for when we take cytology off the skin is to see if there's any type of infection going on there that we need to treat either topically or with oral antibiotics, and then what type of bacteria or yeast or infection might be going on. Here what we see is all white blood cells, and these are the little helper cells coming in to try and help, and then you can see the red blood cells here with some epithelial cells coming in. But what we notice is, again, these small tiny little dots that are all uniform, and those are bacteria. So this dog does have a skin infection and will need to go on to some antibiotics. So you can see we get a lot of information from a tiny little sample that you can bring in, and there's lots of different diagnostic tools we have with that and can really help us point in the direction of what medications and what treatments your pet will need to feel better as quickly as possible.